Okay, so we have our supplies here. We've got one piece of suction tubing, which comes in one of these containers. What I've done is I've cut it in half. I'm going to try to get away with just using one piece of it. And one is going to go to the patient, Dawn here. The other one is going to go between the suction canister and the device, whatever suction device you have to provide negative pressure wound therapy. This one's plugged in and ready to go. So the first thing I'm going to do is try to just connect the suction canister to the device. And so there's usually on the suction canister a little label for vacuum. We'll just close off the other ones. This one in particular that's not needed. And then I've cut this in such a way, like usually these are designed perfectly to go on these barbs, but just to save myself a little bit of tubing here, I'm going to try to force this onto there just to get that on there. Hopefully that'll do the trick. All right, so that's our suction canister and our tubing ready to go. We'll just put this off to the side. Now I'm going to prepare the dressing. And so what I'll need is any kind of porous material, whether it's foam or gauze, and then we'll need our sticky plastic film. This is just some simple IOBAN. It doesn't need to be sterile. Typically when I do this in the operating room, the gauze will be sterile and we'll fill the wound. Obviously Don doesn't have a wound right here, but we'll pretend he's got an open forearm after a fasciotomy, for example. So that will be sterile, and then we apply this non-sterilely and then connect it to our suction device. So if you're using gauze, what I will do is I'll fluff it up. That will allow it to have the porosity to allow the suction to evenly be distributed across the entire wound surface. And so if there is a wound, what you do is you begin filling the wound up from the base, and you want it to be filled up to about 3 to 4 centimeters above the surrounding skin level from the uninjured skin. So that's what I'll do here. Just fluff a bunch of this gauze up. I know you're desperate to help me. I appreciate that, Don. So we'll just fluff a whole bunch of this gauze up. And I'm not going to go too crazy here, but I'm just going to make a little bit of a wound. Pretend that there's a wound here on Don's forearm, and then that will be full of this sterile gauze up to about an inch or 3 to 4 centimeters above skin level, the surrounding skin level. And what that will do is it'll cinch down once we put the dressing on. So then I'm going to take my sticky IOBAN and I'm going to sort of get a sense of how big the forearm is. And I'm just going to cut the IOBAN in order to create the seal. Let's see if I can get it all in one go. All right, so we'll make that into a nice little wound there. And we'll start by applying this IOBAN. And ideally, you don't want to go circumferentially all the way around. But you do want to make sure that you dry the skin around of any blood or sweat or anything like that. And then you want a nice ring of seal all the way around. So this is perfect as it is. Then the next step is we're going to cut a little hole into the dressing. Just a small one, you don't want it to be too big. You can just use some instrument to make sure that you're through there. And then we'll take the remainder of our suction tubing here. And what this will do, what I'll do here is I'll cut this at an angle. If you want to come in and see the angle, we'll cut that sort of at like a 45-degree angle. And that will create sort of a nice sharp point to it. Nothing that can hurt the patient or anything, but something that will more easily penetrate through the dressing. And you can get fancy and you can really get it in there deep by adding additional holes in the dressing that will prevent clots, clogging, that sort of thing. But what we do now is we just insert that into the dressing material. And this is replacing your more fancy kind of devices that all come packaged all as one. You want that nicely nestled inside. And then we'll connect this to the suction tubing, the suction canister. And so the next step here is we have to create a nice seal around this guy. So what I typically do for that is I will use a little bit of this material, and I'll cut a nice little hole in here, nice little slit. And this, usually it's easier if you have two sets of hands doing this, but that's okay. So we take this guy. Oh, and you see that's why it's easier to have two sets of hands. I'll try it again here. Don't worry, Olivia, so I think I can handle it. And so this guy now, we're going to start underneath here and just create kind of like a little seal on this side of it. Thank you. So that seals that edge, and you can hear it, but it's still leaking up at the top. So now we'll take the second half of this. Just relax that down. I'll lay that right on top. Create a nice little mesentery. You already see, because the suction is connected, it's already collapsing our wound. Sometimes it needs a little bit of a start there. And then, if we just move this out of the way, you can come and take a look here at the canister, the gauge. You can see that we just have a little bit of suction pressure, which is great, but what we can do is we can increase the suction pressure by tightening our bleed valve. And that will increase the pressure. And you want it really to be between like -4 and -5. -4 is really perfect. And you just adjust it to the right level. And that's it. And so this should collect all of the fluid. You definitely don't want any fluid coming into the pump, because that will contaminate the pump for future patients. And if you come and look at the wound, you can see it's very nicely collapsed here. And Don, does that hurt?
Nope.
No pain. Excellent. Thanks.